Hello everybody, it's Dr. Galvin with today's coronavirus update. I'm continuing my quest to try to film this video in as many different nooks and corners of my house as I can now that we're locked down. Today's numbers, 2.6 million cases worldwide, 180,000 deaths worldwide so far, 700,000 people have recovered. In the US, 830,000 cases, 45,000 deaths, 75,000 recoveries. Of note, that number of deaths is up 2,600 since yesterday. So 2,600 Americans have passed away from the virus since yesterday. That's nearly what we lost in 9/11. New York City, 140,000 cases, 11,000 deaths, up 313 today. North Carolina, 6,950 cases, and we're up to 213 deaths. I will come back to why I mentioned New York City later on in the broadcast. Today, what I want to do though is talk about a question I've been asked probably 50 times now in the last maybe 48 hours. And that's the question is, are hospitals A, overinflating numbers, and B, are they being paid by the government to do so? And is it all a conspiracy? And I can pretty safely tell you that no, it's not. There is quite a bit of stuff going around Facebook and internet, and there's some politician that mentioned something like this, that hospitals are getting paid $13,000 for patients they diagnose with COVID-related pneumonia, and $40,000 if those people are getting intubated. And you know, it's all, and they're calling everything COVID, no matter what the cause of death really was, and it's patently not true. The 13,000 number and the 40,000 number are probably legitimate, and those are based on what are called diagnostic related groups. So if you come in and you are diagnosed with, say, pneumonia, and you spend 4 days in the hospital, the government, Medicaid or Medicare or whoever, will pay based on that diagnosis. So they say, well, a typical pneumonia costs X, and in this case, the typical admitted pneumonia costs about 13 grand. If you end up in the ICU on a ventilator because of some sort of respiratory failure, the average payment for that is about 40 grand. So yes, they are getting paid that if it's a COVID diagnosis, but they're also getting paid that if it's a pneumonia diagnosis. So nobody's telling them, you know, cook the numbers one way or the other. Now, the CARES Act does give a 20% multiplier to those charges for patients that are admitted with COVID. And that was placed because of the loss of revenue that hospitals are seeing because all the elective surgeries, which really keep the doors open, are being canceled and everything else. And we've talked before about how the fact that, you know, personally, hours being cut, pay being cut. Why is that? Because people aren't going to the hospital because A, they're afraid, and B, everything elective is being canceled. But the other thing is that I can't call somebody who comes in with a gunshot wound and dies COVID, because it's fraud, and you know, we'll get prosecuted, and nobody's telling me what to do and what not to do. If anything, we are more than likely underdiagnosing a lot of these cases. A lot of these people are dying at home. We're seeing big jumps in numbers of people dying at home. Well, the only thing that's really changed is the virus, and that's why New York City changed their numbers a couple days ago to add a bunch of people that they think presumptively died of COVID at home because they had symptoms, and they died prior to getting tested. Now, the other thing is, their testing's not great. The other night I was working, I had a gentleman that came in from a prison that we know that there's an outbreak going on, and this is an older guy with diabetes and a lot of medical problems who came in with high fevers and cough and shortness of breath and low oxygen saturations. You know, a textbook case of COVID, and we did a rapid test on him and it came back negative. You know, we were all pretty surprised by that. And I called my colleague to get him admitted to the inpatient team, explain what's going on. Said it certainly sounds like COVID, but his test is negative. He's like, oh, don't worry about it. We'll repeat it tomorrow because, you know, in our hospital, we've got a 15 to 20% rate of false negatives, meaning you have the virus and the test comes back negative. So for that guy, he was you know, unperturbed. He's like, yeah, we'll recheck it in 24 hours. It'll probably come back positive because the guy clearly probably has it. So the numbers are not being cooked in any way, and I think we can safely put that to bed. And if you don't believe me, look at factcheck.org or Snopes or any of those fact-checking organizations. I think they'll back up what I'm telling you. The other couple little things we're talking about is hydroxychloroquine. Now, that's something we've talked about on this broadcast many, many times, and I think you'll agree that I've been a bit of a skeptic the whole time. Certainly never believed it was a cure, and, you know, wasn't really very happy with those initial studies because they were just terrible. Well, just in the last couple days, we've had a few new pieces of evidence, including a VA study that showed no improvement utilizing hydroxychloroquine versus not using it in patients recovering. And the combination of hydroxychloroquine and azithromycin, or Zithromax, showed almost a twice doubling of the death rate because of QT prolongation. Those particular medicines can cause a lengthening of part of the electrical signal in the heart, and that can predispose you to going into ventricular fibrillation or ventricular tachycardia, which can cause sudden death. There's an NIH panel of experts that have looked at all of the data, and what they've concluded is that hydroxychloroquine and azithromycin together are probably potentially dangerous. Don't use those. Hydroxychloroquine alone, there's really not enough evidence to say whether it helps or hurts, but it's certainly not the miracle drug that that many people, including some of our elected representatives, have been claiming. And I think that that's important to understand. Now, why did I talk about New York City in the numbers today? I'm a human being just like all you guys. I have a family, and we have family divisions and everything else. And I'll tell you a little bit about my personal situation. My wife, Paula, and I have been married for 26 years. Paula is Dominican. Her parents are Dominican, live in New York City in the Bronx, and have lived there for a long, long time. And they have been with us serendipitously because they happened to be here at the end of January, and they were going to stay for a couple months, and they were supposed to leave at the beginning of March. And then all this happened, and we were able to convince them not to go. They have been demanding to go back home, demanding, and they don't, as much as we try to get them to understand how dangerous it is going from rural North Carolina to New York City, a state where we've got, 200, deaths the entire time versus, 11,000. And we've involved their doctors in New York who have told them not to come. Our family members who are in New York who have told them not to come. Paula's close friend, who they know very well, whose sister-in-law just died of COVID, told them not to come. About 2 or 3 weeks ago, they were insisting to go, and for the first time in 26 years, I raised my voice to my father-in-law, and it bought us 3 weeks. But now they've gotten to the point where they're insisting, they're threatening to go. I'd get on the train and go. And I don't think them going up there is safe by any means. Do I agree with it? Do any of us agree with it? Anybody in the family? Absolutely not. But if you have older parents, you may realize that sometimes they are very, very stubborn. They are of sound mind, and they're going. And so I've decided that it's dangerous for them to get on the train here, go to Grand Central Station, get on the subway, go across town to the Bronx, and then have to restock their apartment because they haven't been there for months. So I'm going to drive them there myself. I'm going to leave North Carolina tonight. I'm going to drive to New York City. I'm going to load up with all the supplies they're going to need for at least a month. I'm going to personally move them into their apartment. We have family members up there that are going to be checking in on them, providing them whatever they need. They have promised to stay in the apartment, and I've exhausted all my influence. I've pulled in everybody I can think of to try to convince them otherwise. Is it a smart thing? No, it's stupid. It makes no sense at all, but they've made up their minds, and I'm not going to put them in danger by letting them get on a train, and they don't want to fly either. So the update tomorrow will be a little bit different. I'll probably be in New York when I update. So I debated about whether to share this or not, and I've been honest with you guys as much as I possibly can, and I don't think that this is any different. If you asked me, called me up and say, hey doc, should I do this? I would say, no, you're nuts, don't do it. Here I am doing it. So I'm going alone. I feel that of all my family members here, I'm the one that's best equipped to do it safely, to understand what the risks are, to take all the appropriate precautions. So I don't know what to say. What can I say? I'll be going, I'll be updating tomorrow. As usual, wash your hands. I'll be doing quite a bit of that the next few days. Take care of yourselves, take care of your families like I'm doing, and take care of each other. Now, if you notice, there's been a little bit of a format change. We've been posting to YouTube and back to Facebook. I'm sorry if that's got people annoyed. Nobody's really complained, but we're having some people help us to get the word out, and that's what they say to do. If you like the videos and you happen to be around YouTube, please subscribe to our channel and also hit the little bell. I've got a whole series of individual question and answer videos that I was going to film the next day or so. Probably not going to do that because of this unexpected trip, but I promise I'll get working on that in the weekend. And then there'll be a library of common questions you'll be able to go to on YouTube and just search for it. So again, if you like our, follow us or like our, give us a like on Facebook as well. Please be safe. I will give you an update from New York tomorrow. See ya.